Hey, this is Dr. Dickerson, and today on our episode of Be Intentional, we're answering questions about liposuction, specifically Vaser liposuction. And one of the questions that I get quite often during consultations is, what are the complications of Vaser liposuction? So, liposuction comes with its own pretty regular things that we kind of talk about that could happen, and they include unevenness, they include some excess skin, they can even include some areas of numbness. One of the things that Vaser Lipo helps us do is actually contract skin using ultrasound technology and heat, so there can be areas of pigmentation changes. There's even a risk of burning. Usually it's temporary, but those things we do talk about when in regards to some complications about Vaser liposuction. The one thing that the Vaser helps us do is when it shakes up that fat into little small blebs, and it's easier for us to come out, hopefully we'll have less of that unevenness. Now, once again, that is still a factor of your surgeon, what your body is, what are the other things that we're doing. Are we doing any skin tightening? Are we doing any muscle plication? Are we doing any fat grafting? So those are the usual things that we talk about as far as risk for Vaser liposuction. Patient asks, are they a candidate for Vaser liposuction on their lower and their upper abdomen, and will there be any loose skin? Well, let's think about this. If we have a balloon full of fat and we take the fat out, we're going to deflate the balloon. So we do have to look at the skin quality. Skin quality that may not contract as much as it is somebody who has a significant amount of stretch marks, or even has a muscle that's been separated. So we want to make sure that we need to do something with that skin. You can use skin tightening devices, radio frequency, you can do a little skin trimming. So after taking out that layer of fat, or that fat right below the skin, we want to do something to kind of tighten up the bed sheets. So either skin tightening devices, using Vaser Lipo to help tighten it, using a skin trim as well. But once again, it's the nature of that quality of the skin, how much it's going to shrink. Nobody has that crystal ball. So speak to your plastic surgeon and cosmetic surgeon to get the best option for you. So this one says they've had liposuction back in 2017 and they've developed some fibrosis. Will Vaser Lipo help them out? First of all, fibrosis, healing, the transformation of the skin trying to shrink is all very normal after liposuction. One of the ways that Vaser Lipo, got my trusty hat on today, can actually help is it allows us to kind of shake up that fat and loosen up that fat. And then with other techniques, sometimes we'll break down those fibrous bands so that things can lie a little bit flatter. So I do think Vaser liposuction is a great technique to help out with some of those scarring, to help even that out. Sometimes if there's some excess skin, we may need to do a little skin trimming, a little mini tummy tuck. But once again, check with your plastic and cosmetic surgery specialist. So who is a good candidate for Vaser liposuction? We first want to figure out, well, who's a good candidate for subtraction, as I say, for fat removal. And with that subtraction, is there going to be any complications or some irregularities we're going to create? So places where there's storage fat. Where is there good storage fat? Submental area, buffalo hump, around the arms, upper abdomen, lower abdomen, flanks, what we call a little hip roller there on the back, and of course the extremities. Now, if there is a good opportunity for us to remove some of that storage or even structural fat to give us the curves and the contour that we want, you are a great candidate for liposuction. Vaser liposuction just kicks it one up higher. It gives us the opportunity to shrink some of that skin. We do a really nice job of etching those areas. So even though we take out some of the fat, so to speak, we want that to kind of trim down. And then when we can etch the side of the abdomen muscles, we can actually even etch in the middle. We can even do etching in those areas that we want to create hills and valleys to the arms, so that there is even a more of a muscular or defined look there afterwards. So if any of you out there are once again interested in subtraction, and once again it's just the fat underneath the skin, it's not the fat underneath the muscle, then Vaser liposuction will do well for you. So we have a patient on here to ask a question. They want to intentionally sculpt their jawline and remove their submental fat. are they a good candidate for Vaser Lipo? Do they need Vaser Lipo? So let's kind of go through some of those things that allow us to say, how do we address this jawline and this submental fat pad? Well, there's always a diet and exercise is one. The other one is there are products out there that help melt the fat. There is using very small microscopic cannulas to remove the fat. And then there's opportunities for us to remove the fat, add skin tightening with radiofrequency devices, or use the fat that's under here to remove it via Vaser Lipo. One of the things that we like about Vaser Lipo in this particular area is it allows us to shrink the skin. So for those individuals that don't have that great elasticity, a little bit more mature, don't necessarily want cutting, or even if they are combining it with a facelift, it gives us that nice opportunity to shrink wrap of that skin. So removing this fat pad underneath here, defining the jawline, and the great thing about Vaser Liposuction, if we actually shake up the fat before we take it out, we can repurpose that. We can basically now, it is your all natural filler for your lips, for your nasal labial folds, for your cheeks, for your ear, but it can also even be micronized with the stem cells to help with the skin, help with the hair, old scars, things of that nature. What's the difference between smart liposuction and Vaser Liposuction? So what we're trying to do is that before we remove the fat, we're trying to prep the fat. How do we prep the fat? One of the opportunities, or one of the first modalities, were to put tumescent fluid. And so that fluid basically separates the skin from the muscle and creates a nice plane for us to remove the fat. We provide numbing medicine, hemostasis, as well as pain control. Now, pretty much all of our liposuctions do that in some way, shape, or form, because we want to have the patient to be controlled with their pain. But now, prepping the fat. Smart Lipo uses a very small fiber that allows us to go in between that layer, heat the fat, and melt the fat. By doing that, the fat should come out a little bit easier. You can get some skin tightening as well, but once again, we're always worried about irregularities. So a well-seasoned Smart Lipo suction provider can actually heat it in a nice even plane and give us a nice even removal of the fat. Vaser Liposuction actually uses ultrasound. So if you think of your fat as a bunch of grapes, when we put the Vaser wand in there, it uses ultrasound to shake it up, and we take those bunches of grapes and into smaller little grapes, if you will, and then that allows us to once again remove the fat nice and easy. And the question for today is, for their flanks, can they achieve a V-line using a Vaser Lipo? Please go to your local plastic or cosmetic surgeon to see if you are a candidate, first of all, for liposuction. But for those who they are, and we want a nice tapered effect, who have good skin quality, we can remove those areas along the sides to give us that shadow or that guitar or cello or viola shape. Using the Vaser also allows us to tighten the skin. That gives us a much more refined shape. And then when you use some of the more advanced techniques to allow for the shadows for the midline and on the flank, you look even better in and out your clothes. So yes, it is possible to create a nice V-line, not only in the front but also in the back, using the Vaser Liposuction technique. And is Vaser Liposuction option after traditional liposuction? So traditional liposuction is where we take some fluid and put it in between the skin and the muscle to create that gap for a more safer plane for us to remove some of that fat. For those individuals who, let's say, over the years, life has gotten in the way, there's some changes, there's a reaccumulation of some fat, or there's some areas that you want to touch up in new areas, will Vaser help us? The great thing about Vaser, especially using the ultrasound technology, it allows us to break up the fat in some of those fibrous bands. Using our local anesthesia, or what we call tumescent technique, it allows us to once again take those big clumps of fat and turn them into smaller little areas, and therefore allow us to subtract them. So for individuals who have had liposuction, it is not contraindicated for you to do Vaser as well. Check with your local provider and to see if that's a great option for you. Ask them questions: risks, benefits, complications, alternatives, price, how many have you done, do you have an accredited facility, all of those things that you want to know as an informed consumer of what's best for you. the question says, can liposuction remove fat from my cheeks? So we have talked about before removing the fat underneath the skin, in the jaw, in the submental area, in the neck, and other places in the body. But what about the cheeks? Can we actually use that ultrasound device? Where can we put it to kind of break up that fat? That one is probably not the best option. If we have an individual who has chubby cheeks, first of all, they're going to be evaluated by their anatomy. But most people, if they want to know where that fat comes out, if you kind of, little suckling effect, this is where you're going to see that fat pad right there. It's called a buccal fat pad. And what we do to do that is we do a very simple procedure where we go inside the mouth after it's numbed up, even with some sedation, small little incision. We tease that out, and it allows us to basically get a size of a golf ball shaped fat. So you can see removing that right in that area will give us a little bit more contour, minimize the round shape of the face. Sometimes we'll add on a little neurotoxin, Botox, Jeuveau, Xeomin, Dysport right in this muscle right in here. So for those of you all, when you clench down on your teeth and you feel that bulge, we can put a little muscle relaxant in there to bring the shape of the face down. Buccal fat pad removed. Then you can maybe do a little liposuction with the Vaser. Once again, all great sculpting techniques. Minimal incision, minimal downtime. This is a patient who is getting ready to have their Vaser lipo done, and they have thyroid dysfunction. And what we mean by that, in her case, she has low thyroid. And so are they at risk for anything for doing Vaser liposuction? So this is why it's very important to go to a physician or provider who understands, once again, the total body, doing a full history and physical, checking your meds. It is not just about doing the procedure. That's the easiest thing that we do, but we want to make sure you're a safe candidate. So going over the medications, the allergies, the previous surgeries gives us an idea of your health status. And as long as, especially in this individual, if their thyroid levels are normal because they've been taking some thyroid supplement, they should do just fine. Please make sure you discuss those things with your provider to see if there are any other additional testing. In this individual, if her hormone replacement of her thyroid is at its normal level and she's not having any symptoms, that along with the help of sometimes their primary care provider will give them the clearance that they need. Once again, make sure you check with your provider if all levels are equal and where they need to be, and you're not having any symptomatology. There's a good chance you'll probably be able to get your surgery. So I hope that answered your question. This has been Dr. Dickerson. Hope you enjoyed this episode of Be Intentional. Like and click below. Talk to you soon.